سنة الامتياز فرصة رائعة للاستثمار من خلالها لتحقيق كفاءات خريجي كلية الطب. حصل تحديث وتطوير رائع في هذه السنة، برامج متطورة، تعاون كبير من كافة الجهات الصحية الأخرى. أشكر جميع القائمين على هذا البرنامج وهذا التطوير، أشكر وكالة الكلية شؤون المستشفيات، وإن شاء الله تعالى تكون نموذجاً يحتذى لكافة الكليات الطبية في مملكتنا الحبيبة لتحقيق كفاءات خريجي كلية الطب بإذن الله تعالى.
Assalamu alaikum wa rahmatullahi wa barakatuh. Welcome. My name is Dr. Ahmed Badrega Al-Amoudi. I'm the Vice Dean for Hospital Affairs at the College of Medicine at Al-Qurى University. This video aims to provide an overview on the internship program, as illustrated in the internship program manual. It also aims to highlight the importance of the portfolio, not only as an assessment tool, but one that is a catalyst for lifelong learning. But before we start, I'd like to take this opportunity to thank all our colleagues, physicians and healthcare workers in hospitals and in the community throughout the healthcare sectors in the kingdom for their help in training our colleagues, the interns. I'd also like to thank our graduates, the interns, for their feedback, insight and innovation that have brought about changes currently in practice in the internship program. Thank you very much.
Assalamu alaikum. Welcome to the internship program. My name is Dr. Abdurrahman Hassan Hussein. I want to introduce the internship portfolio today. But first, we will define what is a medical intern. A medical intern is a physician in training who has completed medical school, but they have yet to receive a full license to practice unsupervised medicine. The internship program consists of a 12-month period in the following specialties: internal medicine, surgery, pediatrics, obstetrics and gynecology, family medicine, emergency medicine, and lastly, a 2-month elective of the intern's choice. The core principles and goals which guide the creation and the correct use of the portfolio are as follows. First, that the interns practice and enhance their clinical skill within a safe and supervised environment. Second, that interns perform procedures common to all specialties. Third, that interns respond to common inpatient or in-hospital emergencies. That interns develop the ability to correctly interpret investigations, whether laboratory or radiologic results. That interns carry out safe prescriptions of common drugs. That interns adhere to high medical and societal ethical standards. And lastly, that interns protect patients' confidentiality and autonomy. Therefore, the internship portfolios have evolved as a catalyst for self-directed, lifelong learning. The individual is given the challenge to define who and where they are on the journey to becoming a fully trained medical practitioner. In other words, it is a lifelong endeavor. It is intended learning, both curriculum-driven and of personal intern objectives. The intern portfolio supports the professional requirement for doctors to commit to lifelong learning. It is accountability to our patients that all doctors who have current evidence of their ability to practice in accordance with the standards of medical practice. It supports a process of continuing professional development and provides a vehicle for demonstrating this to another person. In other words, the internship program and other supervisors. Therefore, the portfolio consists of the wide range of documentation. It is, as stated by former educators, a purposeful collection of work that exhibits a student doctor's efforts, progress, and achievements in one or more areas. It includes participation in selecting the content so the intern can tailor it to his or her specific needs. And importantly, it is an evidence of self-reflection. Now we will discuss the details of the intern portfolio. We will now review the contents of the internship portfolio. Each section of the portfolio has 4 repeating forms. Forms A, B, C, and D. As you can see, Form A consists of a mini clinical evaluation exercise. This is an assessment of the OSCE type. One is required each block, and the assessor can be from among either senior residents, clinical tutors, faculty education supervisors, consultants, experienced clinicians, or the program coordinator. And the competencies which are tested are as follows. The professional approach, history gathering skill, physical examination skills, clinical diagnostic skills, patient management skills, communication skills, humanistic qualities, and overall clinical proficiency. Form B consists of management guidance appropriate to each rotation, as well as procedures logbook. So for each rotation, the procedures and cases that are recommended will be highlighted, and it is an ongoing process. This, we advise, is signed off by each assessor as it is done, not at the end of a block. Form C consists of a full history and physical. It is a blank template, and at least 2 are required each block. There is a space at the end for reflection for each intern. Form D consists of case-based discussion, and the assessment type is an oral presentation. 1 is required each block. And the assessor is from the same set of Form A, from a senior resident through the program coordinator. Competencies tested are data gathering, data interpretation, clinical reasoning, decision making, clinical management, managing medical complexity, quality of record keeping, and that is typically Form C which will be used, and case presentation skill. So this is an oral presentation, the Form D. And the typical sequence is the intern will see a case, then they will write up the case visit, and then they will present it orally to the assessor. Whereas in Form A, the assessor is in the patient room with the intern and a real patient, but not otherwise interfering with the patient visit. Form D is strictly between the assessor and the intern. Thank you for participating in this instructional video on the internship portfolio. I hope that both assessors and interns found it helpful, and that it will be used as a tool for growth and development of the professionalism and the lifelong education of the young physician. Thank you very much.
Bismillah ar-Rahman ar-Rahim. I am Dr. Al-Baqir Mahdi Ahmed Hassan. We are going to go through the medical internship program manual, which is a guide meant to assist the interns, the clinical supervisors, and training the instructors through the program. It outlines the educational and training objective and competencies, and provides structure to training and assessment of the program. This manual is prepared considering national and international experiences, such as King Saud ibn Abdul Aziz University and Al-Imam Muhammad bin Saud Islamic University, and international experiences such as the Canadian Royal College of Physicians and the United Kingdom Foundation Program and the Australian Curriculum Framework for Junior Doctors. In addition to The manual states the principles and the goals of the internship program. The principles give idea about the training objectives and educational activities and assessment methodology of the program, and also represents the learning domains of the القرى University and Saudi Med competencies, such as scientific approach to practice, patient care, community-oriented practice, communication and collaboration, medical professionalism, research and scholarship. The principles also stresses on the importance of the interns to act or be part of a multidisciplinary team so as to make sure of delivering a high quality medical care. Also, the interns will have a chance and opportunity to work in a rich learning opportunities, which provides a self-directed learning and supervised teaching and practice-based learning and developing direct responsibility for the patient care and making clinical decisions and under supervised and safe clinical environment. The manual also clarifies the goals of the program, which fall under 12 summary statements: clinical competencies, safe patient care, and medical professionalism, communication skill, and maintaining of medical learning. The manual also shows the organization of the program and the series of administrators. The program is under the Vice Dean of the Hospital Affairs, Dr. Ahmed Badreg, who is the program director and the accountable for the dean in the taking strategies of the program and making decision about the interns, whether they have complete and fulfill the criteria to have finishing the internship. Under him, it comes the medical internship unit, which is directed by Dr. Abdurrahman Hassan Hussein and assisted by myself, with the assistant of our team in the secretary, Mr. Basim Al-Amari, Mr. Muhi Magadmi, and Ms. Taghreed, who represents the female side. This unit deals with the day-to-day activity of the program and communicate with the hospital coordinators who coordinate the field activities, ensure attendance, and assess adherence to program objectives and provide in-hospital support for the interns. Also, there is a male and female student leaders who are involved in the application process, provide coordination with the student and interns on deadlines, feedbacks, and year-to-year modification and on the application process. Also, we have a communication with the hospital academic and training affairs who receive our students or interns and submits the formal communication between the hospital and the faculty and addresses any issues that occurs during the program. Also, finally, we go to the clinical supervisors who are directly involving in training and educational assessment of the student or interns within the work places and hospital. The activity of the medical intern unit runs the administrative affairs related to the medical internship program, and it deals with the issues related to the interns and prepare an ideal training and learning environment and promote research related to medical internship and advise the medical interns on future careers and choices and their opportunities. The manual also defines the role and responsibility of the clinical supervisors in the hospital and their educational activity and requirement of the interns to fulfill. Finally, the manual goes through the objectives and clinical competencies in each medical specialty where the interns have in each clinical placement and the methods of assessing these competencies either through a formative assessment or summative, and provides the role of portfolio in the assessment of medical internship program. Thank you very much.